A suspected case of hantavirus has triggered the activation of high-level bio-isolation protocols in Washington, D.C., as federal health authorities move to contain a potential local manifestation of a growing international public health concern. The patient, whose identity and specific origin have not been disclosed for privacy reasons, was reportedly rushed to a specialized containment facility equipped to handle highly infectious pathogens. This development comes amid a period of heightened vigilance, following a confirmed outbreak of the hantavirus strain on a cruise ship in the Atlantic Ocean earlier this month. While hantaviruses are generally known to be endemic to specific regions of the Americas and Eurasia, the current situation in the capital is being treated with extreme caution due to the unique characteristics of the suspected pathogen. Unlike the sin nombre virus more commonly found in the American Southwest, the Andes virus, identified as the driver of the recent maritime cluster, is the only known hantavirus capable of person-to-person transmission. This specific biological trait necessitates the use of rigorous isolation measures that go far beyond standard hospital respiratory precautions. Public health reporting indicates that the patient is currently undergoing a battery of diagnostic tests to confirm the presence of the viral genome. In the broader context of virology, hantaviruses are members of the Bunyaviridae family, typically characterized by their transmission via rodent reservoirs. Most cases in the United States occur through the inhalation of aerosolized viral particles found in the waste of infected deer mice. However, the geographic location of this suspected case in the nation's capital, coupled with the ongoing international monitoring of repatriated travelers, suggests that surveillance systems are operating at peak capacity to detect any imported infections. Official statements from the Centers for Disease Control and Prevention and the World Health Organization have emphasized that while the risk to the general public remains statistically low, the severity of hantavirus pulmonary syndrome, which can carry a fatality rate of nearly 40%, requires an immediate and robust clinical response. The framing of this incident as a shock reflects the rare nature of such bio-isolation events in urban centers, which are more typically prepared for common seasonal pathogens rather than rare, high-consequence zoonotic viruses. Medical professionals in the district are reportedly following established containment checklists, which include negative pressure environments and the use of enhanced personal protective equipment to prevent any potential nosocomial spread while the patient's status remains unconfirmed. The core of the response in Washington revolves around the technical capabilities of the city's bio-isolation infrastructure and the precision of laboratory diagnostics currently underway. Medical facilities in the District of Columbia, including the National Institutes of Health Clinical Center and specialized units at regional trauma centers, are among the few in the nation designed to manage pathogens requiring the highest level of biocontainment. Clinical reports indicate that the patient likely presented with the hallmark early symptoms of hantavirus infection, which often mimic severe influenza or other acute respiratory distress syndromes. These include high fever, significant muscle aches in the large muscle groups, and rapid-onset gastrointestinal distress. The transition from these prodromal symptoms to full respiratory failure can occur within hours, making the speed of the rush to isolation a critical factor in patient survival. On the laboratory front, scientists are utilizing reverse transcription polymerase chain reaction, or RT-PCR, to detect viral RNA in the patient's blood or tissue samples. This molecular approach is the gold standard for rapid confirmation, though it is often supplemented by serological testing to identify IgM and IgG antibodies, which reveal the body's immune response to the virus. Global surveillance data from May 2026 highlights the complexity of the current landscape. The World Health Organization recently confirmed a cluster of cases involving the MV Hondius cruise ship, where at least 11 individuals were identified as confirmed or probable cases. Of those, 3 deaths were recorded, underscoring the lethal potential of the Andes strain. Health agencies are currently contrasting the claims of potential exposure with verified travel histories and contact tracing logs. In Washington, the logistical challenge involves not only the clinical care of the suspected patient, but also the monitoring of any individuals who may have been in close, prolonged contact with them prior to isolation. The CDC has issued a Health Alert Network advisory to clinicians nationwide, urging them to maintain a high index of suspicion for patients presenting with unexplained severe respiratory illness and a history of travel to affected regions or contact with wildlife. While the source material focuses on the immediate emergency in D.C., the underlying clinical developments suggest a broader effort to synchronize local hospital responses with federal oversight. There is currently no FDA-approved vaccine or specific antiviral treatment for hantavirus. Therefore, the focus remains on aggressive supportive care, including mechanical ventilation and extracorporeal membrane oxygenation, or ECMO, if the lungs become too fluid-filled to function. The lab results from the DC unit are expected to be the deciding factor in whether the city maintains its current posture of heightened alert or transitions back to standard surveillance. Public health guidance remains focused on a dual strategy of environmental prevention and rigorous clinical surveillance as the investigation into the Washington case continues. For the general public, the primary methods of preventing hantavirus infection involves the management of rodent populations and the safe cleaning of potentially contaminated areas. Health officials emphasize that individuals should avoid stirring up dust in areas where rodents are present, as the virus is most commonly transmitted when dried urine or droppings are disturbed and the particles become airborne. Recommended protocols involve the use of disinfectants like diluted bleach to saturate nesting materials before removal, rather than sweeping or vacuuming, which can aerosolize the pathogen. Regarding the specific threat of the Andes virus strain and its person-to-person potential, the CDC has clarified that such transmission is extremely rare and typically requires close, intimate contact with a symptomatic individual or their bodily fluids. Therefore, current guidance for the residents of Washington and the wider United States does not include broad community restrictions, but rather focuses on the monitoring of high-risk travelers. The limits of current scientific knowledge are also being addressed with transparency. The incubation period for hantavirus can range from 1 to 8 weeks, creating a significant window of uncertainty for public health officials tracking potential exposures. This long tail of possible onset makes persistent surveillance essential, even after a specific incident or ship-based cluster has been identified and contained. Looking forward, the global health community is utilizing this event to test the efficacy of international health regulations and the speed of cross-border communication between agencies like PAHO, the ECDC, and the WHO. While the news of a bio-isolation event in the capital is significant, it serves as a reminder of the permanent infrastructure designed to catch and neutralize such threats before they can reach the general population. Authorities maintain a calm but firm stance, noting that the isolation of a single suspected case is a sign of a functioning safety net rather than an indicator of a wider outbreak. As diagnostic continue in the lab, the focus remains on the patient's stability and the continued observation of the repatriated groups. For more updates on this developing public health story, please consider subscribing to this channel. The core developments in the District of Columbia center on the rapid mobilization of specialized medical teams and the high containment laboratory procedures required to manage a pathogen of this severity. While the specific medical facility has not been publicly confirmed to protect patient confidentiality and facility security, Washington is home to some of the world's most advanced biocontainment infrastructure, including the National Institutes of Health's Special Clinical Studies Unit and regional high-consequence infectious disease centers. The rush to isolation indicates that the patient likely presented with acute symptoms that met the rigorous clinical criteria for Hantavirus Pulmonary Syndrome, or HPS. Clinically, this typically involves a prodromal phase characterized by high fever, severe myalgia, particularly in the large muscle groups of the thighs and back, and profound fatigue. However, the urgency of the transport suggests the patient may have entered the critical leakage phase, where the virus causes the capillaries in the lungs to become permeable, leading to rapid pulmonary edema and respiratory failure. In a bio-isolation setting, the patient is housed in a negative pressure environment designed to ensure that air flows into the room but cannot escape without passing through high-efficiency particulate air, or HEPA, filtration systems. This is a critical safeguard against the aerosolized nature of the virus. Laboratory testing is the current priority for federal and local health agencies, because hantavirus symptoms in the early stages closely resemble more common illnesses such as influenza, COVID-19, or even Legionnaire's disease. Definitive diagnosis relies on molecular and serological assays. Specialists are currently utilizing the Laboratory Response Network to perform reverse transcription polymerase chain reaction, or RT-PCR, tests to detect viral genetic material in the blood. Simultaneously, clinicians are looking for specific hematological markers that often signal a hantavirus infection, including an elevated white blood cell count with a shift toward immature cells, a significant drop in platelet counts, known as thrombocytopenia, and an increase in hematocrit levels, which indicates that plasma is leaking out of the circulatory system. These internal biological shifts are what make the virus so lethal, often requiring the use of advanced life support measures such as extracorporeal membrane oxygenation, where a machine oxygenates the blood outside the body to allow the lungs to rest. Surveillance teams from the District of Columbia Department of Health and the Centers for Disease Control and Prevention are now tasked with reconciling the suspected status of the case with the patient's recent history. This involves a dual-track investigation, identifying any potential environmental exposure sites and conducting contact tracing. Although most hantaviruses in the United States, such as the sin nombre virus, are not known to spread from person to person, the suspicion of the virus in an urban center like Washington necessitates a high degree of caution until the specific strain is identified. In an urban environment, health officials also monitor for the sole virus, a type of hantavirus carried by common Norway rats, which typically causes hemorrhagic fever with renal syndrome rather than the pulmonary form. The contrast between these strains is significant. While HPS has a mortality rate near 40%, HFRS is generally less fatal but can cause permanent kidney damage. Government officials have not yet indicated if the exposure is believed to be local or travel-related, but the activation of a bio-isolation unit suggests that medical authorities are taking no risks regarding the potential for any atypical transmission. Until the lab results are finalized, the patient remains under strict observation by medical staff utilizing enhanced personal protective equipment, including powered air purifying respirators, to ensure no breach in containment occurs during the diagnostic window. The public health response to the suspected hantavirus case in Washington relies on a well-established framework of environmental mitigation and clinical vigilance. For the general public, the primary takeaway is that hantaviruses are not a widespread threat in the same manner as seasonal respiratory viruses. Rather, they are opportunistic pathogens tied directly to human-rodent interactions. Prevention is grounded in the concept of integrated pest management, which focuses on eliminating the entry points and food sources that attract rodent reservoirs into human dwellings. Health officials emphasize that the most critical prevention step occurs during the cleaning of potentially infested areas. Because the virus is transmitted through the inhalation of aerosolized particles from dried urine, droppings, or nesting materials, any action that disturbs these materials, such as sweeping or vacuuming, increases the risk of infection. Official guidance dictates a wet cleaning protocol, saturating the area with a disinfectant, such as a 10% bleach solution, for at least 5 minutes before wiping it up with a damp cloth or paper towel. This method ensures that viral particles remain trapped in the liquid and are neutralized before they can become airborne. Furthermore, individuals working in enclosed spaces like sheds, attics, or crawl spaces where rodents are present are advised to wear gloves and in high-risk scenarios, N95 respirators to minimize exposure to contaminated dust. From a surveillance perspective, the incident in the District of Columbia highlights the ongoing efforts of One Health initiatives, which monitor the intersection of animal, human, and environmental health. Local departments of health frequently conduct sentinel surveillance of rodent populations to identify the prevalence of viral shedding in specific regions. While the deer mouse is the most famous reservoir for the sin nombre strain in the western United States, other species like the white-footed mouse, the cotton rat, and the rice rat carry different hantavirus strains in the east and south. In urban centers, surveillance is also tuned to the sole virus, carried by the Norway rat, which can cause symptoms even in domestic pet rats. The current limits of knowledge remain a significant factor in these investigations. The incubation period for hantavirus pulmonary syndrome can be notoriously long and variable, ranging from 1 week to as long as 2 months after exposure. This creates a challenging window of uncertainty for epidemiological investigators, trying to pinpoint exactly where and when a patient may have encountered the virus. Furthermore, While the Andes virus strain found in South America has shown evidence of person-to-person spread, there is currently no evidence that North American strains possess this capability. Though scientists remain cautious when a case appears in a high-density urban environment, the ethical considerations of reporting on such high-consequence pathogens require a balance between transparency and the prevention of public alarm. While the presence of a patient in a bio-isolation unit is a serious medical event, it also demonstrates that the systemic safeguards designed to protect the capital are functioning as intended. The activation of these protocols is a proactive measure, intended to isolate the threat while diagnostic certainty is established. The medical community continues to advocate for a calm, evidence-based approach, noting that the risk to the average citizen remains statistically minimal. As the investigation into the Washington case continues, the focus remains on the rigorous application of science to identify the source of the infection and ensure the safety of the medical staff providing care. The honest limit of current medicine is that we lack a specific cure or vaccine for hantavirus, making early detection and supportive clinical management the only viable tools for saving lives. This incident serves as a reminder of the persistent nature of zoonotic diseases